could be SI. You see how complicated this differential diagnosis can get. So my advice to you is treat total hips. It's much simpler than trying to figure this stuff out. All right. Yeah, thanks.
Okay, so these tests. These provocation tests for the SI joint come from Mark Laslett. Came out in 2005. He's done a follow-up study where he was able to drop out the Gainson's test. So we'll probably skip that one for time's sake and stick with these other 4 tests here. But the idea was he could, in the article, they were able to use anesthetic block to determine if it was truly coming from the SI joint or not, and was able to say if 3 out of the 3 or more of these 6 tests were reported as 94% accuracy of true SI joint pain. The problem, and we'll talk about this later when we start treating SI, his treatment was then to send them to physicians, and that has irked me, and I still don't understand what the logic is behind that. But anyway, because I think we can treat SI joints pretty well. But anyway, so these are the provocation tests, and it was a big paper that came out, and everybody was all happy about it. So, but these tests are pretty simple. So what I'm going to do, Trevor, is I'm going to put my hands on your hips, if that's okay, and put some pressure down. And then I just want you to tell me if that changes anything for you, okay? Now, one thing I'll always tell my patients, ASIS can be uncomfortable, so that's not what I'm looking for, but if it is uncomfortable, let me know and I can change my grip, okay? So I'm just gonna get over the top of him, right, his ASIS, real wide with my hands to disperse my pressure, and then push straight down. And then just wait for him. Laslett in the article said, do you wait up to 2 minutes, which I have never done.
Dr. Robinson, are you putting like your weight
Yeah.
down?
Change his hand slowly.
You okay?
Yes.
Yeah, I'm trying to provoke his pain, so I'm leaning into him. You do okay?
Yeah.
So I was bugging one of his ASIs. He told me to move. Is that better?
Yeah, that's better. And just a lot of pressure.
Yeah. So we just wait and talk and, look into each other's eyes. But generally, this will bring his pain on. Now, relatively quickly, so within 30 seconds is what I've found, and generally it's quicker than that. So that's the first test. It's called the distraction, SI joint distraction test. Next one, we'll skip Gainsland and go to this posterior shear test.
Did you expect it to be the same pain that I was having with my hip and pain kind of thing, or just any pain?
Yeah, I just ask for pain. Generally, it's pain. People with SI joint will come in with pain right here, and so that's what I'm mostly looking for. If it went into your hip, I wouldn't discount it, but that's generally not what what people are complaining with. But I have had people who have SI joint that's going in kind of wraps around that will reproduce. Next one, and you'll see this one looks really intimate, but as a patient, and you'll feel it, it's not as bad as the picture looks, but keep the door closed or let your patient know or keep the door open, whichever. Weird shoes. But what I'm gonna do is, I'm gonna get right here on your sacrum, okay? So I'm gonna roll you and get my hand under, and then I'm gonna load that sacrum. Same idea, if you feel a change, you let me know, okay? So I'm just gonna bend your knee up, and then go ahead and you don't need to move. So he shifted a little bit, and I don't really want him to. But I'm just gonna get my hand here, you see where I'm just putting it right on his sacrum. And then I'm gonna roll him over the top, okay? And now I'm just leaning and loading his hip into that sacrum, against the sacrum. See, it's creating a shear there. Do you feel violated? Okay. But it looks pretty bad, right?
That's a good question.
Yeah, I wouldn't ask my patient that, but, just so you guys know.
No, there's someone who's weird. They can go back.
Yeah, so he's getting some relief, which is the reverse of provocation, so another negative
Yeah, it's right
test
down.
here.
What is this one called?
The Posh test or posterior shear. So this guy. Okay, and then if you'll scroll down.
Dr. Wilkinson, would you do that bilaterally, or you just need to do it on one side for?
It would be on the same side as the pain he's complaining of.
Okay.
And I showed you that way so you could see it more than, because this isn't more of your pain over here. Yeah, so I'd do it on the other side. And then this one is called the sacral thrust test. So let me have you on your stomach now. Put your head in the hole there. And again, I'm gonna be on your sacrum, is that okay? So you see, when we get informed consent, usually at the beginning, I think we go way overboard on, can I touch your knee, can I touch your leg, can I, so that gets me a little crazy. But when I'm touching places that seem a little more intimate, I'll get more consent. So I think, now I'm getting on his butt. Most people don't like their butt touched by someone that they don't want their butt touched. So is that okay if I get it? So now I'm just gonna again, I'm on the sacrum, and I'm just applying pressure straight down. And waiting for him to give me a report. Again, looking for provocation. Doing okay?
Yeah.
So, really simple tests. But if 3 out of these 4 are positive, I'm almost, I'm 95% or 94% sure that it's a true SI joint dysfunction. Question?
I was gonna ask, on the Posh test, he said he got some relief, I think. So could these be used also as interventions, treatment, or, okay.
Yeah, typically, what we'll show here are some muscle energy techniques that aren't really like these, but certainly, especially this one, this is a sacral mobilization, really, and I've had a lot of patients like, oh, just stay there. Can you stay there forever? So it becomes absolutely treated. Question?
So how much pressure are you supposed to put down? Because just putting your body weight, that's going to be different for somebody who weighs 120 pounds versus somebody who weighs 300 pounds. So do you just kind of put your body weight on it? Did you just go until they start?
Yeah, you're trying to provoke. So if you get, we never want to jump in, but Trevor could tell you, I just kept adding pressure slowly over time until I don't have any more to give him. And if you were to get it earlier on, well, then I haven't given him a lot. So you're just loading him. So it's a slow, gradual increase, and that's maybe why you need some time. I wouldn't say 2 minutes, but some time to kind of load them up. Okay. So the last one, I'll have you on your side. And again, it doesn't matter which side. Typically, I'd have him face away from me. If you'll do that for me. Let's do that under there. So this is called the sacral, the compression test. I always get the compression and distraction mixed up because depending on where you look in the joint, you're kind of doing both of these things, a long joint. And so you're providing both compression and distraction at the same time. This one's the compression test. So I'm at the iliac crest, and again, I'm just gonna load it. So he needs to be really on his sides. You saw what happened as I started pushing, I started rotating down. I don't want that. I just want to be straight down. And I'm just loading again, looking for provocation.
You just find a spot between the greater trochanter and the iliac crest and just kind of press in there?
I'm just right on the top of the crest, just kind of thinking that's, I'm loading that the joint. Okay, you doing okay?
Yeah.
And again, he might complain of pain just from my pressure of my hands. So if he says, oh yeah, this is starting to hurt, I've got to say, okay, well, where is that hurting? If he says, oh, right under your hand, that's not what we're looking for. We're looking at the provocation of his symptoms that brought him in.
Do you do this on either side or the side of the pain? So if they say.
Yeah, generally, again, it's loading both sides, so I don't really think too much about it. Okay, but I am expecting, if it's gonna provoke, I'm expecting it to be where he came in and said, it's right here. That's where I'm expecting it to be. Okay? Any questions? Wanna try that? Oh, one more question.
For that shear test, the hand that was on the sacrum, you were going the opposite direction? Is that what you're doing?
Yeah, that's just the fulcrum, and I'm just loading the hip joint onto the sacrum, so I'm getting that shear. Okay.
What like signs would you expect in order to do these tests? Like if you're deciding to test the SI joint just because, why?
Generally, they're coming in with pain.
Pain specifically?
Yeah. So we're trying to see, is this lumbar pain? Is this hip pain? Or is this SI joint pain? And so sometimes it's a little unclear. Most of my SI joint patients say it hurts right here, it's right here, okay? But I've also had patients that it's wrapping around and it's seemingly more like a hip OA or hip dysfunction pain, and it turns out to be SI pain that's just following that pattern. Okay? So should we try it? Is that what